had a chance to review the minutes?
So moved.
Second.
Anyone object? So, Turner's got to be back for the
ARPA stuff, yeah.
Yeah, we'll do the ARPA stuff.
And you need Bill for the second thing.
We can do, department.
Why don't you do your department update, and
Okay.
and when they make it back, we'll jump in the middle of there.
I did not make that PowerPoint slide, just so you know. I'm more than happy to do that if there's data to share. This time it's really just an update of just what's going on within the services of the health department. So our COVID update, cases continue to steadily decline. We've had the lowest number since March of 2020 this week with under 100 cases, which is wonderful. Our phone bank remains operational. I hate phrases. All the calls are going into our preventive office right now, and they're really minimal, few and far between. Our vaccination clinics are very slow, under 20 at our last COVID clinic, which was the second Wednesday in June. This month we only have 2 people signed up. One is a first dose, so we're happy about that. We are doing clinics at the county jail on a continuous basis now. ACR Health, which is a local unit that's in Fulton area, and our migrant camps. We're doing clinics. Actually, we have a big migrant one getting set up sometime, hopefully tomorrow. We'll pick a date so we can get out to our migrant camps. The Dunsmore Farms, they have a large population that just came in. So, pediatric Pfizer doses started yesterday. We didn't have any. I did lift the mask mandate at the health department. We only wear the mask during clinic and when it's operational. Just so you know, I did check with the other health departments on what their mask mandate were. Only 2 are doing it where all staff has to wear them all the time. One is Jefferson and one is Lewis because they're attached to a hospital and they have to. So I did do some homework. I didn't just look at that. Immunization clinics we've been increasing our numbers. Back to school numbers are going up. So we're going to plan a couple evenings and weekends sometime at the end of August, beginning of September, so our kiddos don't get kicked out of school. We are offering hepatitis A because we did have the hepatitis A outbreak right before COVID hit. So we're offering that at the jail. Every time we go out to do a COVID clinic, we're offering hepatitis A also, which has been working very well. Mosquito surveillance, we started in June, as everybody knows. We are focusing on our EEE mosquitoes. We look for West Nile and other viruses also, but EEE is the one that everyone knows is the one that hits our region. It lives in swamps. We have several. Yes, we do. We do have 11 sites that are set up with traps and resting boxes. So 5 of one, 6 of the other, and they're in undisclosed locations throughout the whole county. No pools have come back positive, but we are on weighted breath right now. We know that usually the 3rd week in July is when we start getting a positive here and there, so we are tracking that daily now. Rabies, we've had 4 animals test positive, 2 raccoons, 2 foxes, and that's out of 18 that were tested altogether. We administered 158 vaccines at our last clinic that was held in Parrish. Our next scheduled rabies clinic is going to be July 13th, right at the West Monroe Town Highway. and we're hoping for a really good turnout for that. It's looking like we're hitting over 100 every rabies clinic that we're doing, so that's great numbers.
Good.
Super Dirt Week, we had our first all-agency planning meeting yesterday. Not a lot of people showed up, but that's okay. I believe Judy was really hoping for all agencies to attend this one. The organizer really has everything under control. He's ready to submit all the documents that the health department needs. So that is underway. It is our 7th year of having that in Oswego, but it is their 50th anniversary. So he's planning on a big show, including a couple flyovers. So he's getting federal approval because we have the nuclear power plant. You just can't fly over there. So it's pretty exciting stuff. Our 3 to 5 program, for the first time in 30 years, we had the ability to raise our rates. It's $5 more a half hour, and that includes for speech therapy, occupational therapy, physical therapy, and all the other related services for these children. We're really having a hard time contracting with the therapy services, so we had the opportunity to raise the rates, and we were able to do that. That was approved in the budget, and it starts in July, so that's exciting news for us. Hospice, we did receive approval to go forward with the closure plan for our hospice program. So this week we're starting to notify our patients. We have 5 that are current, and then we have 114 bereavement families that are open with us, and we're going to notify them also. With this plan, nothing changes. We continue to provide those services until either they revoke, that means they no longer want our service, they don't meet criteria medically, or if they pass away. With the last patient that passes away, we will continue the 13 months bereavement. So our closure plan does not end, and we don't have to submit or turn in our license until December of 23. Yes, 23. Sorry. Monkeypox is on our radar. As they know, we did have a state call last Thursday. Currently, New York State has 120 active cases, and that's as of this morning. 111 of those cases are in New York City. Westchester, Chemung, Rockland, Sullivan, Norfolk, they all have 1 case. Westchester has 5. The U.S. has a total of 560 positive cases, and globally around the world, there's right around 7,000. This morning, we did provide a situational update with all of our partners that work in this population, and it's really targeted to a certain population of men having sex with men. And it's really not going outside of that population. So we are working with partners, ACR Health, that provides treatment for HIV. We're working with OCO, which works with the LGBTQ plus community, and the big push is to get the information out there about what's available, and it's vaccine. Vaccine is the treatment, and vaccine is what's going to slow down this virus that's going around. I go into symptoms, but I don't want to really do that to you. But there is a provider update that's going to happen next Thursday, where all the providers in our community will be invited. New York State Department of Health kind of had more urgency with this matter. We have not had a suspected case, possible case, or case in Oswego County yet. Do we expect some? We may. So with that being said, a lot of the college kids come from New York City to go to SUNY, and SUNY was also on the call. they are ready and willing, whatever it needs. If they need to order the vaccine too, they understand. They get it. They know how to do the testing. We went through all of that with them. It is a red phone disease, illness. So even if it's a suspected case, we will know about it first. We just got to get our providers to recognize it and test, so we can identify our first case if we're going to get one. Which I suspect we probably will get a couple. I can't imagine that we would even, in ordering vaccine, we're not going any more than 20 doses. This group population, they're not going to come to the health department, so we have to meet them where they're at. We know that. So it's really working with our providers as much as we can to get them updated. Does anyone have any questions for me? Yes?
During your dissertation, you mentioned the, I won't say clinics, but the people were tying up trying to vaccinate COVID. And it's dwindled down to where you're hardly getting anybody to come to this.
That's correct.
Is it cost effective at this juncture to have those people tied up doing that? Or would it be more cost effective to take those people and reassign them to, because COVID wasn't here only a couple of years.
Right.
They did other things, other functions.
We scaled down our operation to the need only. And it's all appointment only, so we know exactly when the people are coming. We do have a walk-in portion of the clinic. It's during regular hours. So we're really not pulling any staff that.
All right, so we're not tying up people. Okay.
Not at all. We're minimal.
Because everybody's going to get vaccinated,
Oh.
vaccinated by now. I mean, let's be real.
We had one sign up for the first dose.
That's
I agree. I agree. You never know what you're going to get. But once in a great while, you do get someone that sign up for the first dose of J&J usually, and it is surprising, but it does happen. You're welcome.
Right.
I'll wait till after her, because it's not about her report. I have other questions that I want to ask about, not to cover her report.
If I could, Mr. Chairman, I'd just like to do a shout out to the Judy Grandy and the environmental team. The manual for mass gatherings for Super Dirt Week is maybe this thick, and they have done a great job putting together a process where now everything just lines up. And like she said, it's the first year was atrocious, and now it's very routine, and everybody knows what they're supposed to do, right down to the EMS folks and the people from out of town. Just a shout out to what great organization the environmental team did to get it to that point in this period of time.
It's a well-oiled machine, no doubt about it.
So as Vera mentioned, one of the conversations that we had was PowerPoint would be if she has an abundance of information that needs to have some clarity. Or if this committee decides they want a PowerPoint of her presentation, she will do that. Otherwise, she will give a verbal report and follow up with anything. You may contact her. Feel free to do that. It's not a criticism, but if you all remember the COVID slide, you couldn't even read what you were looking at, and Ching Chang did an excellent job of giving us that report verbally, but the slide didn't really make a lot of sense to her. So Vera and I talked, and she's going to kind of go this route. If you want follow-up, or you want to follow up of her report, that can be emailed to you, or she can bring a copy to this committee. We'll leave it up to the committee to decide which way you want to go with this. Or if you want the PowerPoints, there'll be a PowerPoint. She's going to go whatever direction here. Okay, so think about that and let me know, and let Vera know. we'll try to keep everybody happy. Right? We are going to break here because Dave wasn't here, and so we're out of. So we'll come to you in just a little bit. You're up, Mr. Turner.
I saw that you had ARPA on the agenda. I'm not sure what your intent was. If you had items on the table that you were going to take off the table, or just one update.
Well, the understanding is that they've passed it back to the committee to make that decision. So we need to have that discussion. As I understand, we have 2 items that were tabled.
One, yeah, there's one.
We only have one.
The last guy was one. Yeah,
Right.
yeah, it was hospice. What do we get in?
And you're not with the last guy.
No. So,
They were invited to be here and explain to us
okay.
So the plan was to untable it if they were here.
if they were here.
My understanding was that there was some concern about the UV process.
Right.
And I am not by any means an expert in that process, but I can tell you that this is happening everywhere. People are changing from chemical to UV. It's it's been recommended, it's what's preferred, and whether or not the UV is as effective as people would hope, or whether or not it requires additional maintenance. The intent of the change was to eliminate those residual chemicals that are being used now, that you can't get everything out of the process once you put it in there. So eventually some of that stuff makes its way into the effluent that gets discharged to the water body. And that was really the benefit of UV versus chemical.
And that goes into the Salmon River.
That particular one goes to the Salmon River, yeah.
So, what do you guys want to do? Take this off the table and discuss it? You want to leave it there?
Well, it'd be nice to hear from them.
Yeah, we will, because we want to hear directly from the representative of the company.
Okay.
Could make a suggestion that perhaps one of the engineers, Bill Aikner or somebody at the health department could speak to that process, because Alaska is probably not going to send a public employee. They likely would send their engineer to talk about it, and I don't know that we maybe have that expertise in-house as well.
Would you let us know if he has that expertise that he can speak to it?
Is that what we wanted to know, or do we want to hear from them?
Yeah, the request was to hear from them. And that was pretty clear.
I mean, it's like saying, well, okay, well, let's pull somebody off the street and ask them about what they think about that horse, you know?
Well, what specifically
They make it or not.
was that question? That's
I don't think there was a particular question. I think it's the process because it's new to everyone. And there was concerns about, that piece of it. Nobody understood exactly what it is. And I know you're making a great attempt at explaining that. Maybe health can, but I think that, it almost was to the person that they wanted to hear back from the people putting the system in.
so likely their engineer is
Yeah.
what you're looking for. Okay.
Right. Is that still the consensus?
Yeah, because it was supposed to be, as opposed to a salesman making a pitch,
Right.
we're just selling it.
We don't want the sales.
So in which, if that's really what your intent is, then perhaps unbiased opinion, not the guy who's designed the system and said, this is what I'm going to put in. Somebody who understands the pros and cons of chemical versus UV, which is why I suggested maybe the health department, because they don't have a dog in the fight. It's just, if that's the information you're looking to clarify.
It's up to you guys.
Maybe we have both then at that point. I mean, because UV, I don't know if folks understand UV or what they're trying to do, but all they're doing is they're passing the water as it discharges, I'm sure, or into a pool over a set of bulbs. And those bulbs are constantly running. That UV, they used to use it for printing, for curing ink. It was an instant cure. So I'm sure it's an instant kill or whatever they're trying to hit. Those bulbs are driven and maintained by hours. They aren't, they're changed out. They reach a life after so much of a point. A lot of people try to keep them in to get more life out of them, but they'll have to change them. If in this case, I'm sure they're changing them at the recommended hour. And they'll know if they go down, if they're shot, because they trigger. There's a trigger for that. They get reimbursed if the bulb make it through their life. So I mean, there's a lot to it in terms of maintaining it, but for the most part, it should. If it works like it does in the printing industry, it should be a home run.
Okay. Still committee decision, not mine, gentlemen, you know that.
Oh, I'd like to hear how they're set up.
Okay, so why don't we request them, and if you have somebody that they can both be here.
I would say they'll take care and that'll be for the August
Okay, put them
meeting.
down for August.
Yep.
Good with that?
Okay.
So that remains tabled.
So you'll get a hold of Bill, and I'll make sure Pulaski understands that you want somebody here, because I don't know if anybody reached out to them. This was the first that
Okay.
I learned that you had asked them to come.
That might have been a crossover between one person and the other person sitting in a room right now that
I didn't send them.
I just wanted to see if you
I
felt
didn't send them an
guilty.
invite.
Look at him, he's like, me? That's the guilty one right there. Guilt time.
it was right at that moment here where things were.
Coincidentally, you'll be meeting in Pulaski in August 10th, so it shouldn't be a stretch for those guys to be there. So we'll go to them.
That we could have a meeting ahead of the legislative meeting to just cover this. Committee meetings won't be meeting.
Oh, correct. Okay.
But we could
have a special.
We could have a special just for that.
Is that when you think you do it? Or do you want them to come to your August meeting?
Well, if we need to get it back on the agenda.
Yeah, if they want it on the agenda for August, they need to be here at committee.
Okay.
Otherwise, have it up there, it's gonna be on the agenda in September.
Yeah.
So you're not gonna put in a special meeting, you're gonna wait until the August meeting, correct?
Yeah,
That's the
August,
next,
next committee.
that's the
Right.
next committee meeting for
That's what I
us.
said.
Okay.
Okay.
Okay, all right. I was told we had 2 items that were taken.
No, just the one.
Wait a minute, what about the one for St. Luke's or whatever?
That was human
That's
services.
human services.
Yeah, and they don't talk about it.
All right, everybody happy year? Okay, you're up.
Okay.
Would you like the, you want to control yourself?
Oh, sure.
That's saying.
Pass the mic.
That's easy. That's
Saying he doesn't want to mess it up.
Give it over.
Alright,
Pass
So I'm gonna introduce,
That would be a good idea, you can do that.
this is Megan Tice. She is our public health educator for our OD2A, which is Overdose to Action team. She's one of one. She has her master's in public health with a concentration in epidemiology. She has agreed and is going to be one of our fellows for our core fellowship program.
Oh, nice.
So very exciting stuff. So we will miss her in the OD2A because she has moved this program it's been amazing. This grant does end next summer, August 23. We're kind of sad about that. Funding does go away. They may renew it, but we're not sure. But she has done unbelievable amount of work on this program. Take it away.
Thank you.
You're welcome.
All right, so I'm just going to give an overview of the program and what I've been working on, and then some of our plans coming up. So, as Vera said, it's Overdose State of the Action is a CDC-funded initiative with the goal of reducing overdose deaths through a harm reduction framework. I'm just going to give a little bit of background for our data for the county. So we've had increasing overdose death rates pretty much since 2010, which is the national trend. So in 2018, it was 17.4 per 100,000, and then 2019, it was 32.6 per 100,000, so it was quite an increase. And this is the data that I'm using is the most recent data from the New York State opioid dashboard. We also had the highest crude rate of neonatal opioid withdrawal syndrome for our newborns in the state. In 2019, it was 46.3 per 1,000 discharges. So just for comparison, the state in 2019 was actually 7.9. The trend graph that I have on here is for the synthetic opioids, so fentanyl, and that is pretty much what you're seeing on a national trend as well. And that really accounts for most of the overdose deaths when you're talking about opioids. A lot of the data will talk about treatment gaps, and they say that the most recent one was 84%, which is not really, it doesn't really give you a clear picture because it includes people who have received diagnosis of opioid use disorder, but not necessarily looking for treatment, which can be, quite a large population. So this data that I included is a national survey that they did that was really adults who were looking for treatment. So this is 43% who said they were looking for treatment but didn't receive it in the 12 months prior to April 22. And as you can see, its barriers were there's cost, availability, wait times, and proximity, which is definitely a concern when you're talking about rural populations. Sometimes, you have a single treatment program and it's located just not anywhere near where they reside. I also included the 21 data for the county. So non-fatal overdoses was 213, fatal overdoses was 32, and then naloxone administrations was 158. So using the data for the county, we came up with these priorities for the program. Increasing access to buprenorphine, which is the medication for opioid use disorder. Establishing linkages of care for pregnant parenting women, since that population is often one that seems to fall through the cracks when you're talking about treatment. And increasing access to naloxone and harm reduction items. So for increasing access to buprenorphine, we brought in the MATTERS program, which has been pushing out to the rest of the state, starting in Buffalo. It is it's medication for addiction treatment, electronic referral services, and it streamlines the process. If someone goes into the emergency department, they can immediately, through a clinician, can get on this platform and they can be immediately referred to a clinic site. So you receive a voucher for medication, transportation if you need it, and it also connects you with peer services if you're interested. This way, you're not relying on having to make phone calls, trying to find a clinic site that will treat or has availability. It automatically gives you which ones have availability or the earliest one, and the point is for the consumer to be able to pick which clinic site they want to use and when they want to be seen. We also have Reach Medical. We're encouraging, they are a clinic out of Ithaca that offers telemedicine, which is also important when you're talking about rural populations, and there are some people who refuse or who prefer not to be seen in person for substance use treatment. So they offer telemedicine, and we are sharing that information through our physicians in the county. And that is through detailing that we do. So really all of this information is shared when we go into the primary care offices to give them the most recent guidelines on prescribing buprenorphine or resources that the state offers now to help clinicians with that process. So linkages to care for pregnant parenting women is really the same process. We are encouraging matters through the local OBGYN, and that's also done through detailing through there. So for increasing access to naloxone, we have an opioid overdose prevention program at the health department that started in 2020, I believe. And this is a program through the state. We are provided with naloxone, and I can go out and train whoever is interested and provide them with naloxone. So through that program, I have been training in a number of community settings, but also in schools that have been interested, training the staff, and also primary care offices have been interested as well. And as part of that program, we're working on Leave Behind. This is a chance to leave naloxone with those that are most at risk for an overdose. We're working through our first responders, partners that are interested, and they can go to a call of a suspected overdose. If the person refuses transport, they have the option to offer them naloxone if they want it, or a family member or someone else on scene if they are interested. They train them there, meet them with a kit, and we also have a post-overdose recovery kit that we provide, which has some harm reduction items and information for treatment. So as part of our naloxone program, this is one of the ads that we are considering. We're working on bus ads. So this is one that we are working on for to encourage the use of naloxone. And then we also have a stigma reduction campaign, and these are two options that we are considering for that. These are from the CDC campaigns that they rolled out, I think, in March. So that's what we're using for that. So if you have any feedback, suggestions on any of the ads that we're looking at, and any questions about any of that.
Yeah. Excuse me. It looks like we have a lot of different things tools to work with. What's our success rate? Because I'm a little alarmed that 42% of the people can't get treatment, or whatever the case may be. What are we doing to get those people? Because obviously, I say obviously, all I know is what I know what the media says, and you can't believe half of what they say, but on something like this, they're usually pretty good. The amount of drugs that are coming into the whole country, no matter where you are, doesn't matter whether it's South Dakota or Oswego, New York.
One out of every
Pardon me?
1 out of every 7 medications have fentanyl in it that's in this country right now.
All right.
That's coming in from, well, it's being shipped in from the border, but it comes from China. Yes.
All right, that's fine. The origin is irrelevant to me. What's relevant to me is what are we doing to reach out to these people? I mean, you mentioned a little bit about the schools, but the schools they're a tough nut to crack. They are, because they have their own silo and they don't want to be bothered with government at all.
So for treatment information, since we don't have direct services, it makes it a little difficult. You know, we really have to rely on our partners and encouraging other agencies. So we are working with Barnum and other agencies in the county through the Opioid Response Consortium. And so in collaboration, they're sort of expanding services and targeting specific populations. So for our, for treatment, we're really targeting primary care offices to try to encourage, because it's also some new programs that primary care physicians may not know that even exist as an option for referral. So we're getting the information out there. As far as encouraging people getting into treatment, it's really relying on the providers and the other treatment services, you know, to get that out there.
Right, we're sending out a lot of information, but it really is up to the person to get the help they need.
Well, a lot of people our county is diverse in a lot of ways, but there's a very small middle class in this county left, because they moved. And that's a fact of life, they're gone. The people with money, if their child has some kind of problem with addiction, they hide that real well. And the poorer people, and we have big pockets of them, and I don't care where you go in this county. I have one of the wealthiest districts there are, and I have 5 trailer parks, and you know what they're talking, that the demographics that is. It just is what it is. Truth is truth, you can't change that. It's hard to reach those people.
I think that's another reason why the anti-stigma campaign that we're pushing, so people aren't hiding it, saying it's okay. It doesn't discriminate.
No, it doesn't. I mean, it doesn't matter where your social economic criteria you're in.
Right.
It's all over, and I don't know if we're doing a good job. And I say we, I don't mean it's your fault, because you don't even see, years ago you used to see, it wasn't that many years ago. I mean, Frank and I weren't in high school then. We were out already. But the point is, you see advertisements all the time on, like, for example, television, and that's the media. You don't see it on Facebook and all this bullshit. You don't see it on there. And I don't think we're not doing a good job just reaching out to it. It's not your fault. I didn't say that. But we're not doing a good job reaching out to these people.
Yeah.
And along with this being not only an addiction, it goes along with mental health. They run it's neck and neck coming down to the finish line here.
Definitely has some mental health component.
I mean, I'll be honest with you, I mean, I've never heard of this. Never heard of any of this. I got 2 grandchildren, been in and out of jail like crazy. I didn't raise them, I beat them to death, but that's a different story. But the point is, I don't know if we're doing a good job getting that information out. I don't know if we're reaching out to the people and getting it into the community. I understand it's a complex model. I get that. It is extremely complex. So I'm not blaming you guys, but I just don't know if we're doing it, if we're getting the information out there good enough. And like I said, it's just not school children or children that age. The 20 to 35-year-olds is out of control, from what I read. And you read different articles, after a while there's a thread of truth that runs through it.
Megan was able to get into 2 schools, Mexico and AW. Besides them, Narcan treatment.
Should be 9 of them.
School districts.
Yes, that is correct.
Yes,
Should be 9.
More than 9 school districts.
That's correct.
I agree. I think one of the reasons was that it was late in the school year, and I think they just didn't feel that they had the opportunity to have training. I'm going to be continuing to work on it and try to get back in there for the fall.
We also like it's hard to target the burned areas and the stewards, even though we know that overdoses are happening in their bathrooms. We know that. But they're a corporation, so it's difficult to be able to get in there and say, we want to train your staff on Narcan to prevent an overdose.
Mr. Turner.
Treated.
Yeah, I just had a question about, I see you have that listed as transit advertisements. What was your plan for that?
So these are bus ads for the side of the bus.
Outside?
Yes.
Do you have inside planned as well?
didn't know they did it.
I know that that is an option. We're at the beginning of looking at, what options we have for funding. So, yeah.
Well, we own 9 buses, so if there's a way that we can help, let us know.
Awesome.
So I got a couple of points. One actually follows yours. I worked for a major corporation that did advertising buses, and one of the rules was pretty quick and simple was, here's the ad, I want you to walk by it, look at it, and tell me what it said. My concern with the one you've got up there is it may not all get read. You might want to do that as an experiment in your office. When you do something, is put it on a big poster board and ask a few people, I just want you to walk by your normal base, glance at it, and tell me what you thought it said. It's a classic rule in advertising, and trust me, I had to pay the bills for a company that got involved in that. The other one is you hit on it a little bit, Vera. When you're doing the training, one of the comments that come back from another agency and our agency, as a matter of fact, was, is there any liability for that? And I think that's got people a little bit spooked. So if somebody's in the office and they're need that, do we, if a staff member gives them the shot and it doesn't work or something happens, is the corporation liable in court? Or the parents say, well, you didn't do enough or you didn't do it right, da 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 da. And I think that's where you're seeing some reluctance with this. And I don't know the answer to that. I don't know if you know the answer to that. But I think it's obviously, and it could be part of your concern with schools and burn dairies and stewards and stuff like that, where the company's sitting there saying, look, I'm going to protect our back door. And if that happens, it happens. We're not accountable for somebody that went into the bathroom and shot out. We can defend that. Can we defend an employee that's being accused of not doing the injection correctly?
So for naloxone, it is covered by the 911 Good Samaritan laws. So it's considered first aid administering naloxone. So there isn't any liability if you do administer, but I think a lot of people aren't aware that that is part of the Good Samaritan.
I didn't know that.
Right, and that is actually a campaign that the consortium is working on, and I'm sorry, it's the Prevention Coalition is working on.
Okay.
So I think also you are going to run into trouble, even with knowing that with the corporations that just don't want anything to do with that on their property.
Well, I don't think it's going to open the door completely for you, but it might open it a crack, and it might open it a little bit more for the other nonprofits that have not stepped into that yet and said, okay, as long as we know that we're not going to be liable for it. We've had a couple that walked into our office, and obviously they were in trouble. They know who we are, and they weren't going to go into Planet Fitness and ask for help. They just sold them a membership, but.
If anybody wants naloxone training, I think it's more than happy to schedule a time to come out
Okay.
and train staff.
Any other questions? Yeah.
The one over there.
I'm sorry, go ahead.
On the EMS side, I've been working with agencies. We're creating these cards that have QR codes on them, so when you scan it, it's going to bring up a PDF with firing a bunch of different clinics for mental health and drug resources. So this way, when agencies do hopefully make a recovery of an individual, they can hand in this card and say, they can't call the phone number for them, but at least they're going to start leaving behind a resource sheet, so to speak.
How wide are those circulated right now?
They're not. They're in the process. We have an EMS advisory council meeting next week.
Okay.
We're going to hopefully lock in what we want the cards to be, and hopefully use that budget line to print them and start getting them to the agencies so they can hand them out to the people that
Good. That's a great half step. I admire that.
So,
I just wanted to ask, have you guys talked to county attorney about the opioid settlement money and what might be available to you for like public relations and things like that?
Well, yes, I wrote a proposal.
Okay, great.
We need to get a group together to develop a plan how we're going to use that money countywide, because there's health department, there's DSS, there's the jail, everybody's got ideas, and we got to just get a group together to advise you folks on how best to use the opioid settlement.
I think that's a good idea. Turner's not doing anything.
I know.
He knows I like him. What do you know? All right, is that it? All right, I need an appropriate motion.
I have some questions for the.
Are you gonna do your thing again? That's right.
Oh, I can.
Go ahead, go ahead. Yeah, go ahead.
I know that, as of late, everybody's seen the news about the ethanol plant, the town of Valmy, and what it's doing to the surrounding areas. But I have yet to see either state or county health department called in to give their opinion or their professional take on what's going on with the slow burn, as they say it. And people tell us that from DEC saying they're pretty sure that it's not toxic. Okay, we understand that. They're going to put up air monitors. We've had 2 elected officials tell us yesterday that it's safe. And I have to take, being the age that I am, and a lot of you guys are not that far behind me, we were told for many years that a lot of things were safe. They're safe, they're safe, they're safe. And then later on, we wound up that the health department, health people that really get involved say, you know what, it is a health issue. And we're more in tune now with health issues than we ever have been before. But yet, we're having elected officials tell us everything's safe. And they don't have the expertise to say that as far as I'm concerned. But yet, the state and county has not been called in by anybody. And I just want to know what, our health department, if they've been called, has anybody asked you to, take a look at it? And I know that you're limited to your, what you can and can't do, but I'm sorry, I got people in the city of Fulton texting me yesterday on my way home, telling me how can you sell a city when you have the smell so bad that that you can't go outside. So I am more worried about the health issue than the appearance, and I'm more worried about people than I am money. And I want it to be stopped, and I want it whatever way we have possible, whatever door I have to open or whatever, we have to stop it. I'm just wondering if you've been called by anybody other than, about anything on this issue.
We have had a complaint, and I did take her right out there, and it does smell. There's no doubt about it. There is an odor coming from that area. I am thrilled that the DEC is doing air quality tests, and we do stand ready that if we are brought in, we will do what needs to be done. That's my date.
But you haven't been called yet. Well, do you think the DEC or the EPA, because now the EPA is going to get involved, okay, from what I understand yesterday, and usually when that gentleman speaks about the EPA and stuff like that, things do happen, okay? But is it going to move fast enough for, this has been going on since November, and people out in that area, okay, which is just north of you, Richard, okay, have been smelling that and been taking that in since November. Is there a possibility, and I know that
I'm not going to have that answer.
right, will they share their Do you think that they'll share their results from you and you'll be able to get some
If it is a health
professional
issue,
answer?
if there's a health issue, if they deem it a health issue, I'm sure I'll be able.
But they may not deem it a health issue. They may deem it as, it's not toxic. They may not give us it as a health issue. At least the DEC will not give you an answer. I don't believe that it's a health issue. Okay, but,
But
okay, so
it seems like there's a good group that are taking this serious, and I hope it's resolved quickly for the residents of Fulton and that live in that area, because anyone that goes there can tell. There is definitely an order, whether it's a health issue that remains to be seen. We need the data.
would we be able to call in a respiratory specialist to know?
It's not up to me.
No, but that would, what we're breathing, it can't be,
But the air quality test that should have some indicators.
Okay.
Is that correct? I
don't
believe,
know.
I would say.
I don't know.
Okay.
That our health department
That's
doesn't
it.
do air
That's all I
quality
got.
tests, so I would say.
Dave's got a comment.
Yeah, I was just gonna say that, I think that's the path that they're headed down now. I was pleased to hear that they're gonna do the air sampling, because without that data, the health department can't really get involved and make any suggestions or help. So I think this is really the great first step, is to get the data, what is in there, and then you can move to the next step from there.
Yeah, and I know what you're saying. That my issue is that, they turned, two elected officials turned and said, well, we know it's safe. Well, you don't know it's safe because they just started the air testing last week. So you can't tell me that you know that it's safe.
But is it based from history of having another corn silo on fire? And I don't know. I don't know
They
what
just keep
they're
saying it's only
looking at.
corn. Well, there's a lot of things that are emitted from corn burning. But, I'm glad that we've got, the EPA is gonna look at it, but, I feel more comfortable, somebody tells me it's good. Other than the elected official. That's all I have. Thank you very much. Thank you for your input. Thank you.
Bill?
Yes, just quickly, in your packet is a list of legislation that was passed by the Assembly and the Senate of our state in this recent session that relates to this committee. I included that just so the committee could read through them and get back to myself as the chairman if you feel that there's anything there that you want the county to weigh in on prior to these going to the governor's desk. These are things that, as I said, passed both houses, but she has not signed yet. She has till the end of the year. She could sign them at any time whenever they're brought forward to her. A couple of these, as I'm sure Chairman Karasik will tell you, are things that Oswego County lobbied for regarding the terminology used to correctly refer to individuals with disabilities. Some of these involve increasing the criminal penalties for people faking COVID-19 vaccination records, strengthening lead prevention programs, which may have a budgetary impact on us, and adding substances to the contaminants list, creating a fentanyl abuse and overdose task force at the state level, not here. One thing that may help us with costs is allowing, when a person is exposed to rabies, that's often a cost to the county, but this bill allows the county health department, names the county health department as an authority that satisfies any insurer's pre-approval, so that those treatments can be billed to the patient's insurance, and the insurance has to pay it. They can't go back and say, well, we didn't pre-approve it. It's county health department order, so they have to cover it. So that's those in a nutshell. If you have any questions, give me a call. I also included the bill numbers if you want to look them up yourself. If there's anything that you feel we should weigh in on as a county, give myself or Jim Weather a call.
And my follow-up comment, which I made in Human Services yesterday, is the first one and the last one, that effort started in Oswego County. We took that to NISEC. It took a couple of years, and unfortunately for us at NISEC, other people from the Assembly and Senate often attend those meetings, and there were a couple of people that grabbed that and thought that was a great idea. If you're an older legislator, a few years ago, we wrote letters in support of this taking place. It needed to be done. And now the law has passed House and Assembly. So I think it's important that the county write a letter at least supporting those two. And being kind of selfish, I actually think the rabies one's a good one. But I think we need to show that kind of support and tell the governor that you need to sign this. There's also, real quickly, a law that just passed that Arise did for people with disabilities. If they go to park in a rural area and there's somebody illegally parked in a disability parking spot, the state police and the sheriff's department cannot ticket them because there is no law that allows them to do that. You have to have local traffic law in order to do that. So the cities can do it, but other areas can't. An incident happened at Walmart in Granby, and it took 2.5 hours to Bentonville to give permission to tow a car out so a gentleman could use his lift to get back in his van. So that's been about a 4-year fight, and it finally passed, and we are urging the governor to sign that one also. So Oswego County's been on the forefront of some of this, and it's good because it's good for people with disabilities, which I have a slight interest in. Thank you.
And just for the newer legislators, Oswego County was also the originating county for legislation that went statewide to outlaw synthetic drugs.
Right.
We did that here.
That's true. Okay. Anything else?
Yeah, Phil, you maybe correct me if I'm wrong. On the Dakota's law dealing with lead paint, you said there could be a cost. Kind of what?
I'm waiting to look at that, see if it's going to require anything more of our health department, because we have lead prevention programs in the health department. Right now, it looks like other providers are being required to provide more information to parents earlier on like doctors and medical providers. But I want to see if that is going to impact our public education department.
Right.
Just a quickie, because we're running over here. Just about the lead paint on that, all of a sudden that just brought something. Do you need a special permit to remove lead paint from the house?
Yes.
You do?
Mhm.
You have to have a certificate. Does anybody know how you get that certificate?
I think the homeowner can do
You
it.
get through your code enforcement. You go down to, I don't know about the city, but the towns, when you go down to get a demolition permit, for example, or you're remodeling like that, you have to have some kind of a permit. I can't remember what it was or
Who
how much
would do
it
the
is.
training for that though?
Pardon?
Who would do the training to get yourself certified to do that? I'm asking for the guy
Should
from
be through codes,
There's local codes.
local code.
local codes gives you a certificate to be able to remove your own.
No, they give you the application.
Right. Oh,
It's up to you to take care of it. That's as far as, getting the, like I said, demolition, for example. You just can't go tear a house down.
Most people
Or
do
burn.
not do it themselves. They
Or
hire
burn.
someone that is certified to remove lead.
But how do you become certified? That's what I was wondering. Anybody
Local
know?
codes enforcement. They'll go through local codes enforcement. If you tear
Yeah, we
down a
get
barn,
certified.
sure.
I don't think so.
Yeah.
Another thing they can do with lead-based paint is encapsulate it. And the encapsulating is painting. That's how they encapsulate in most homes.
I'll tell you,
Okay.
because I was an expert on it, Skinny Atlas.
Skinny Atlas?
Yes, because any
Because they
building
had
down there,
auto-
they have to encapsulate the remodel.
Okay, thank you.
Dave?
I have a guy.
Somebody's got to be trained. This guy's looking to get trained. so he can do the job, so he can do the, lead paint retail. That's, I'll make the motion. You guys are ready.
Just if there's an interest in reducing lead hazards, there's a lot of federal money right now for like service lines from the curb to the house. We in the planning department don't have the capacity to take on another grant of that scale right now, but if there's a real interest in lead hazard reduction, that's a very common place where lead enters every household. Certainly in communities like ours where we have lots of older homes. This may never be available again, like a lot of federal money that's out there right now, but there's a way to find the capacity to institute that. Basically, we would apply for the money and then just like put out RFQs to contractors, plumbers, and set a price and just put them to work throughout the county. So great program. Just it's going to take some work to.
Before we adjourn, we all agree that Mr. Greco was appointed and elected to that subcommittee position.
So moved.
I'll make the motion to adjourn.
Second. Anybody object?